a massive favour and remind me to stop recording at the end, that would be much appreciated, because the last one I left running and there's just my very confused face while I was trying to sort things out at the end of it, which took a bit of editing. So yeah, if someone could say switch off before you all go, that would be great. But yeah, I'll get the hang of it eventually. I think that might be us for now. I'm not sure. Yeah, as I say, we sent out a new list, so it's always exciting to see who's around and who's doing what. So let me just close that bit down so we've got a proper screen. Lovely. Hello, nice to see you all. Kirsty, Natasha, I don't think have I met you before? I feel like
I don't think we have.
You haven't. Hello. Hi. Cool.
Hi.
Nice to see new faces then. Excellent. Yeah, as I have said previously in meetings, this is a very informal space for general updates and linking up and seeing who's doing what, and we are kind of not reviewing it as such, but we've switched from being monthly to bi-monthly to match up with our other lunchtime programs. So hopefully that will give me, oh, we've got another one in, there we go, let Melissa in. Hopefully that will give us or give me more opportunity to sort of bring in some speakers and people to sort of come and talk to you about what they're doing, or to bring up topics that anybody's particularly interested in. So again, today is a little bit of a quick round robin, who's doing what, and what anybody's up for, is interested in sort of going forward, what anybody's doing at the minute, if there's anything you want some input into, or if you just want to tell us nice stories, that would be all good. So yeah, very, very informal, and yeah, as I say, as little of me talking as possible generally is my rule of thumb. Oh, we've got some more pods coming in. Excellent. More new faces. Hello. Hi, Rob. Hello. Yes, hello. I will give it another minute or so, maybe, just in case. As I say, as little of me talking as possible. So if I don't have to repeat myself too many times, that's even better. Yeah, we're all good. For those of you who've just arrived, I've already started recording, so I hope that's okay. If not, hide your face and run. But yeah, that should be all right. Yeah, so I was just explaining, we've switched the setup a little bit, so we're doing these every other month, and so if there's things that you would like to bring to the group, that would be great. Let me know. I'm very happy for people to, you know, have a slot, but if everybody, shall we just do a quick, or not even a quick, it doesn't have to be quick, you can just go around and say who you are, because as I say, there's a couple of new faces here for me today, which is nice, so welcome. If you want to just say who you are and what you're up to at the minute, and possibly also what you're hoping to get from today, or generally from Stream Green Pearls project, that'd be good. Oh, and I've got another one. It's exciting. Busy today. There we go. Yeah, so if everybody's happy to just kind of do a quick round and say hello, who you are, where you're from, and your sort of green spaces links would be really helpful for me, and then we can kind of dive into anything else that people are interested to know about or talk about. It's Natasha, isn't it? Are you? Yeah. Yes. Yeah. Yeah. You're Tash. Or Tash. That's whatever. Yeah. No. Whatever suits you. You're next to me on my screen, so if you're, would you like to go first, and then just pass on to whoever's on your next to you?
Yes. Tash Hughes for Snoster Healthcare. I am finance manager here, but also I'm part of the execs team, and currently working on a kind of build project. So green spaces is quite priority for us at the minute, but also looking at our carbon footprint and so on. So just here to learn from others, really.
Excellent. No worries. Who's next? Yeah, go on.
To my right is you.
Oh, it's me. Okay, so next one.
Kirsty.
Hi everyone, my name is Kirsty Wavish. I'm the Sustainability Manager at University Hospitals Plymouth. mostly based at Derriford Hospital. Yeah, just also here to learn from others. We have sort of plans for our grounds and gardens team, but grounds and gardens on site, but we're a bit of a construction zone at the moment, so it's not the greatest look to the site at present. So, but it's trying to. We've got a pond, we've got an orchard, and hopefully we're having a bit of a refresh to our herb garden soon. So yeah, it will be good to just hear what other people are doing. Thank you. I will pass on to Timothy.
Hi, I'm Tim Malone at the Royal Devon Exeter Hospital. I'm interested just to hear from what hear from what everyone else is doing around the group. I'd be particularly interested to hear from Kirsty, whether she knows or maybe can find out whether sustainability is a standard agenda item on a lot of the hospital meetings, such as the medical staff committee meeting, which we have regularly. And it sort of occurred to me in the last one we had that we have all these slots for education, medical school, this, that, and the other. And I thought there's nothing here for sustainability. And I thought really there should be. So I'm just wondering, from views around the region, it should be. We talk about finance. Why the hell aren't we talking about sustainability at each meeting and normalise it? I'll pass on to Daphne, who knows who I am.
Thanks, Tim. Hi, yeah, Daphne Marston. I'm the Health and Environment Lead Advisor with Natural England for the South West. My role is all about trying to embed nature connection into sort of the NHS and the health and wellbeing benefits. So very much encouraging greening up of green spaces wherever we can. We've done some training with medical students through Tim, but also student nurses, clinical psychology students, just raising awareness of how important green space is on NHS sites and how people can help improve sustainability. I also spoke to a small group of pharmacists in Cornwall a couple of weeks ago, and I think that's another growing area where we could really look to engage with people. But just a couple of projects we've got which links wide. We've just been developing an RSPB nature prescription for the lizard in Cornwall. I don't know if you can see that. We've got the first version now, and we're doing some training for NHS health and social care staff on the 29th of April for anybody on the lizard who'd like to come along. But again, that's around using nature for health and wellbeing. And we've got the Walk Festival in mid Cornwall at the end of May. So again, encouraging people to get out. But yeah, any ideas on how people can green up NHS spaces, very welcome. Thank you. Shall I pass on to Melissa?
Thank you, Daphne, and I'll have to listen to that recording again to hear everything you just said. It's fascinating. So my name's Melissa Ralph. I'm a landscape architect and I'm making space for nature manager at Cormac. We are a business owned by Cornwall Council, mainly engineering company, civil engineering, but I'm in the environment side of that business, and in particular I manage a team of ecologists and an engagement team, which is why I really like this meeting. It's fabulous. So we are producing a Cormac volunteer strategy. We work with a lot of volunteers on Cornwall Council green spaces and love sharing and learning with anyone around. We work with groups across the county, individuals and groups, and it's all about those 5 ways to well-being that's behind the volunteering. It's not all about just getting hard work done, but that's a bonus to all of us. So social, environmental and financial benefits of volunteering. This morning I had a challenge from the chief executive. How can we promote volunteering to older people including his mum, who's broken a hip and is less able and wants to, do things. So it'd be fantastic to have ideas. That would be my question for today. How can we promote volunteering to older generations or mixed generations? We have had capital funding over the last 8 years, which is fabulous, from Europe and UK, to invest in urban green spaces in Cornwall. They are now the setting for health and well-being, and we want to maximise their use. Someone in my team is doing an apprenticeship in CR&S, corporate responsibility and sustainability. I will invite her to the next one of these meetings, and I'll share this recording. Her role, she has a degree from Eden in conservation and horticulture, and she is an urban ranger, so she has direct responsibility for promoting and organising volunteer sessions, but she's always on the quest for learning and making the most impact possible. So yeah, that's who we are at Cormac. A lot of people don't realise that we do what we do, so any chance to promote, and I'd love to share if at hospital grounds you're interested in meadow creation restoration, that's a lovely addition alongside ponds and orchards. And in Cornwall we're also trying to promote places for people to grow sustainable food. It has to come from the ground up as an interest, and because it's hard work, it takes a lot more level of involvement, but that sort of right to grow movement, and more people's interest in food sustainability, with the world we're in, I think that's a direction to also focus on alongside orchards. So that's me, and I'll pass on to Rob. Thank you.
Sorry, muted there. Hi.
Hello. Oh,
Can you hear
oh,
me?
hang on. Hang on, very quiet. Are you? You did just about. Yeah, you unmuted, but sorry.
Not normally a quiet chat. Can you hear me?
Just about.
Okay. It's strange. Yeah.
Oh,
so
that's better.
Okay. Yeah, Rob Attridge. I'm strategic manager for Arboneck PCN. And work within the Arboneck neighbourhood. So represent 4 practices: the Clays, Branwell, Rosend, and Rebus. One of which, the Clays, is looking at a project at the moment. We're looking to support green space there, but quite a few different bits going on, such as nature prescriptions as well within the patch, but sort of particularly interested to hear what else is going on elsewhere. I've got just sort of really just out of courtesy, I've got a meeting at 1 o'clock I'm gonna have to go to, but I just wanted to dip in today, just to introduce myself, and yeah, we'll come along fortnightly, and yeah, and
Absolutely.
hopefully learn something. Thank you.
Thank you. That's great. Yes, Nicola's just had to dip out. So thank you. Nice to see you all. Melissa, similar to what you said with Daphne, I'm going to have to listen again to remember all the interesting bits you were talking about there. You're the Urban Ranger. Did you say they were at Cormac, or is that?
Yeah. So
Okay.
I had a small team, small but mighty, and we have 2 part-time urban rangers who have horticulture background, but they're the kind of friendly face of Cormac. So they are experienced at organising, promoting and hosting safe and enjoyable gardening and conservation sessions. So we have a programme we promote in Cornwall Council assets, so green spaces, woodland spaces, things like that. So we've got a kind of tried and tested method. Tends to be a sort of 3-hour session, 10 till 1, with a tea break, risk assessment, tool talk, guided gardening, plenty of chat, and it's lovely seeing friendships flourish, social connection. And some of our groups, they meet independently for, you know, coffee and friendship as well. So I kind of think of it like a conveyor belt, that we host and do a lot of hand holding at the beginning. And then where possible, we try and bring people together and encourage them to take off and become their own group, if possible. Some people prefer to work solo, but it's safer and often more enjoyable to be in a group. We have a sign-up system where they register, and then they're insured with public liability insurance, and they talk about what scope of work they're going to do. It's handheld tools. Occasionally people will use lawnmowers and they have to demonstrate competence with a lawnmower, and we have to check their lawnmowers. But we move away. We've done lots of interesting things like promoting mowing with a scythe, which is great for wildflower areas. Done lots of training with Kevin Austin, who is UK champion and lives in Cornwall. He's a natural fantastic teacher. So yes, the urban ranger role, we have two of them, one west, one east. As we grow, we may need more of that. And then the complementary role is the community partnership officer. So when people have taken, you know, the next step and they need a bit less direct support, then we pass them on to someone who offers ongoing backup guidance, the annual renewal of their sign up, and insurance. And we have a small pot of money for materials and tool storage. What we should do more of is having thank you events. We do, if we get anything possible, then we do offer things like training. We've worked with Budding Nature down in far west Cornwall. They're natural teachers, and share introductory level training into urban ecology and connections, and how to notice things. So I like the comments. So yeah, we try and maximize every hour that we spend to bring people in and to connect them to each other. And there's a lot we want to learn, but we're heading in a good direction, I feel. So yes, that's where we're at right now.
Rob, I'm aware that you said you needed to head off at sort of 1 o'clock. Did you say you had you were looking at developing a space? I'm just thinking there might be some connections here that could be useful for you.
I think that's all planned. My colleagues looking at that in the clays. I'm just here really just to learn and
okay.
At the moment, Catherine. Yeah, thank you.
Okay, and that's at the clays practice, is it? Yeah, nice. Okay, nice. I look forward to seeing it if you'd like. Yeah, do share some photos and things. It's always good to know, especially before and afters are always helpful. I always forget to take those. So yeah, we're in the stage of putting together our report, and one of the things I'm doing is sort of rebooting this string of green pearls as a project. So I think initially it started as we had some funding from public health, which was sort of shared out between interested practices who were then able to develop some green spaces. And then I've inherited the project because of my sort of background in community gardening and community engagement sort of things. And actually, I think I've found quite a few of our green pearls don't necessarily know they're a green pearl, I think. So it would be nice to sort of connect all that up again, and make sure people go, that's me, I do that, rather than us sort of as a team in Volunteer Cornwall saying, oh, we've got these green pearls. It'd be nice for people to know who they are, and as you say, Melissa, to celebrate that as well, to sort of do a bit more of that kind of recognition and awareness. So yeah, the more we can see what people are doing, the better. And as I say, we're mid developing our big Atlas report at the moment. So any beautiful pictures and lovely things to say about your green spaces is much appreciated at the moment. So but yeah, hopefully Rob, we can we can help you along your journey with it, and it'd be good to see what your plans are when you've got them available. Tim, did you say you had a question for Kirsty about sustainability, or did you want to sort of? I'm jumping about all over the place from what pops up in my brain. So did you?
Well, I think I asked a question really, and I think probably Kirsty, you'll probably have to find out for me.
Yeah, fair enough.
By
I can probably answer to an extent.
Right.
Sorry, Kirsty, put you on the spot there.
It varies. It's probably the best answer that I can come up with. We do have the sustainability section. We have a sustainability subcommittee that meets on a bi-monthly basis, and then we have sort of teams, departments, wards around the hospital who we've engaged with, and we've encouraged to put sustainabilities onto any of their sort of meetings or briefings. We have a few departments such as pharmacy, endoscopy. I'm trying to think, a couple of the wards where they do talk about sustainability in their team briefs. But the pharmacy and endoscopy ones, they have a proper focus on sustainability. But it really does rely on sort of passionate individuals within that team to sort of take it forward. Yeah. Where we find that we're having to really encourage them to include sustainability, we have less success. I am reporting to the board, I think in a couple of months, because we've done a lot of bottom-up approach with trying to embed sustainability across the organisation. And I think it's come to a point now where we need that top-down approach as well. Yeah. That's the hardest part. And in the midst of financial pressures, capacity pressures, we just don't seem to get a look in sometimes. But I've got a half an hour slot, so I'm going to make my case as best as I can. That's
interesting to know. It's very similar at the RD&E hospital. Yeah. I mean, find out, you know, patient care is our prime responsibility. Actually, everyone's interested in finances and trying to get into budget. And sustainability is seen on as a sort of tick box exercise, nice to have, but not necessarily always there. I'm just wondering, do you know who the current chair of the medical staff committee is at Derriford?
I can find out. I was going to say,
I assume I assume every hospital has a sort of equivalent. That's for senior doctors. So it's for consultants, for permanent staff. We have regular meetings once every 2 months.
We've just had a massive restructure, so a lot of positions have changed. So I think it's not Stephen Bree because he's an anaesthetist, but there's another one. I think it might be Matt Swaby, but I will find out and I can let you know.
Right. Okay. And I'll put my email address in the chat, so you've got it.
That'd be great. Thank you.
Okay. I've just Melissa, I've just spotted your question in the chat. Examples. So the document that we are producing it's called our Atlas. It's the Climate Resilience Team's. Essentially, it's our annual report, but it's a visual kind of report. I will try in a minute and find the link for last year's one. But we report on our sort of 15 action plans. So the Climate Resilience Team has 15 action areas across everything from banking to green spaces to energy consumption, and we report across the county as to who's doing what, how many people are engaged. So it's our report of who we're engaging with and who's doing what. But we try and make it as engaging as possible. So if people have interesting things to say and interesting relevant pictures for the different topics, it's really useful to have those rather than using stock images and things. So it's essentially our climate team report, but it's, as I say, it's always nice to have sort of specific examples and sort of humans involved in it rather than AI or something. Yeah, so it's yeah, as I say, we're sort of gathering up who's doing what. Certain sections are easier to document than others. When we start looking at advocacy and leading, it's very hard to find a particular photo that demonstrates that, and yeah, and even harder to kind of pin it down. So yeah, there's lots of different bits. As I say, I will find our atlas and put the link in the chat for you, so you can have a look. And it's on our website as well. And yeah, we're just working on the new one. So as soon as possible, really. I think we're aiming to have it sometime in April finished, but the template's there, so they're shuffling things around phase. So yeah, I'll add that in a moment. Oh, Rob's had to go, but he did just, what did he say? Oh no, sorry, I'm now reading, which is, excellent TV. Sorry.
So just
Okay.
in my questions, Catherine,
Yeah, please.
who's the audience? Is it the public or?
It's the
It's
report for
not-
the ICB. So it's for our funders essentially. But we
See.
do make it, as I say, we put it on the website, so it is publicly available. But yes, it's our report to the ICB.
Okay, and when you
yeah.
say April, do you mean end of April deadline or?
I should
first?
know this.
Oh, okay, no, you can
Yeah,
come back to us.
Yeah, let's say beginning of, just to be on, yeah, which is in a few days. No, it won't be that early. We're still working on it, so I think we've said end of April is what we're aiming for, to have it
Okay,
to them.
so
yeah.
mid-April for us if we
Yeah,
want to send you something.
If you've got something to share, as I say, I will find the relevant document and share that with you just now, so you can see. Let's have a look. Arbenic. Ooh, okay, that sounds good. So sorry, Daphne, was that is that one that you're already working with Rob on, the RSPB prescription?
No, I just
No.
put it in because I know I think the Arbenic PCM were interested in doing a nature prescription.
Oh, I see. Right, okay, yeah.
But we just had funding to do one for the lizard, but the Cornwall Council are now doing a wider one for Cornwall. So I was just wondering if he'd like to be involved in that, if they've got anybody who'd like to link in.
That sounds like a great opportunity. Amazing. Okay. Let me just have a quick scroll back through. Sorry, my end of the week for me, so my brain's gone a bit mush. Natasha, so what's happening in St Austell at the moment? Tell us about.
Going through a very convoluted process.
Okay.
Currently, so we acquired a Carline House. I don't know if you know where that is.
I don't. Okay,
that was from the council, and the plan is we're going through a closure request process with the ICB to close two of the 3 existing sites in St Austell, GP sites that is, and moving those 2 into Carline House.
Okay. Is this the health? Is it a health park? Is it going to be? Yeah. No.
Yes, the health and wellbeing
yeah.
hub, sort of.
Brilliant.
And so the power of the well-being is in the outside of the building, really, sometimes, rather than the inside, in terms of having green, safe spaces. One of the things that we're aware of is around, particularly the centre of town of St Austell, there really aren't that many green spaces where families can go for a walk. And about 2 years ago, there was a big report done by May Loki in conjunction with the council about making the Colline Road site a real kind of health hub, because you've got the leisure centre there, you've got a park not too far, a local park not too far, but there's also green spaces just behind what the registry office is. Sorry, I'm shouting out names that most people probably don't know what I mean. But it's a very kind of the site lends itself to be a real well-being health hub with outdoor safe spaces that could be converted. We are talking to Active Cornwall about potential, that there is just so much potential for that site, not necessarily on this GP surgery bit, but around working with other partners of how we can make that a much safer, active, with potential garden space, but walks that you can walk around the perimeter of the site. These are just visions that we kind of discussing with partners. There was a report done by the council, as I said, but I'm not sure where that's got to. So I'm trying to getting people around the table again to see what the appetite is.
Okay.
Yeah. So any kind of knowledge that others have to share about how we can unlock that would be really appreciated.
I jump in, Melissa, go for it.
Yeah, Tash, it'd be great to share with you the learning we've had from since 2018 of the Cornwall Council, where I used to work, the Making Space for Nature programme. So we've worked with the University of Exeter, and that was all about delivering excellent quality urban green space for nature recovery, climate resilience, and community health and well-being. So we have had quite a learning journey through those projects and sites. Some of them are in St Austell, but they've been devolved to the town council. So Cemetery Park opposite the train station, and a green space with the meadows on Trenoa Road. So happy to, I guess it would have to come from Cornwall Council. They, if they wish to approach me, I'm a landscape architect, or Cormac, to, even be part of it. But yeah, it would be very useful to share our learning with you.
It'll be amazing.
Yeah.
Can I give you my email, and then maybe we can?
Yeah, definitely. If you put it in the chat or something like that. Yeah, I'm not pitching for work.
No,
I'm sure it's all set in place. But it makes sense to be at the table to share and reflect back what journey we've been on with all sort of habitat creation and the bringing people on board, so that they're part of the design, co-design and co-delivery, which is where we're the gold standard of what we aim for. So yeah, be great to chat to you about that.
It'll be amazing. Yes, appreciate that. Thank you.
Yeah. And in the chat I put, might be a bit premature for you, I put the link for the Syria Awards. So Syria is a national sort of centre of learning, construction industry, so which doesn't instantly sound green, but Construction Industry Research Information Association. So part of that is really promoting biodiversity, nature recovery, and they have an annual award program. I'm have been a judge for a few years now, and sounds a bit close, but I have also entered separately. So I mentioned my young colleague Kelly. She last year was awarded a